The American healthcare debate is often a pendulum swinging between two extremes, maintaining the status quo or adopting a single payer system. But what if we're asking the wrong questions? What if the answers lie not in the extremes, but in the nuanced experiences of other countries? We need to shift the conversation from what we're against to what we're for, and more important, what we're willing to trade off to get there. It's a big one, but that's the topic of this week's Healthcare Triage. Why do we even have insurance? Healthcare is expensive. In fact, it's so expensive that few Americans can afford it if they really need it. That's why insurance exists. Healthcare is so expensive, even with insurance. Many Americans, more than a third, avoid care because of cost. This is much more than any other well-resourced country. Uninsurance or underinsurance leads to severe health consequences. So at its core, the concept of insurance is a social contract. We pool our resources so that no individual has to bear the brunt of an unexpected health crisis alone. But this socialization serves two goals. The first is that people do not avoid care because of costs. And the second is making sure that unexpected illness doesn't lead to financial ruin. These goals, while related, are different. Unfortunately, while these two goals are often conflated, they require different mechanisms to achieve. We want people who need care or even prevention to get it. We want it to be cheap to them or even free. This means little or no cost sharing for such care. Financial protection from unavoidable care, on the other hand, requires some form of catastrophic coverage, often coupled with a high deductible. The US often fails at both. Our high out-of-pocket costs prevent people from seeking necessary care, and people still go bankrupt all the time because the catastrophic coverage isn't enough. You'd think this is an impossible thing to solve, except for the many, many options available to us. Let's discuss. Switzerland, a country as an exchange. Switzerland's approach eliminates government entitlement programs like Medicare and Medicaid entirely. Instead, everyone has private insurance from birth to death. These plans are tightly regulated and decoupled from employment, offering both nonprofit and for-profit options. Out-of-pocket expenses are relatively high to combat the moral hazard, but the system ensures everyone has some coverage. The private insurance market is highly competitive, with over 60 insurers offering basic health insurance. The cantons, states if you will, are responsible for ensuring that low-income residents receive subsidies to afford the premiums. The insurers are not allowed to make profits from the basic insurance, but they can offer supplemental insurance for additional services and amenities. Singapore, government for catastrophes, private for the rest. Singapore offers a unique model where the government provides catastrophic coverage, ensuring that major health crises don't lead to financial disasters for families. This is a crucial safety net that offers peace of mind to its citizens. However, when it comes to outpatient care, the system takes a turn towards personal responsibility. Instead of a fully subsidized model, outpatient care is largely funded out of pocket by individuals. To facilitate this, Singapore has implemented mandatory health savings accounts, HSAs, known as MediSave. Every working individual contributes a portion of their income to their MediSave account, which can then be used to cover routine medical expenses. This approach encourages prudent spending, as individuals are more conscious of their medical expenses when it's their money on the line. In addition, Singapore's hospital care system is explicitly tiered, allowing patients to choose the level of service they desire. At the base level, services are offered at a minimal cost, ensuring that everyone, regardless of their financial situation, has access to essential care. However, for those who desire more amenities or quicker access to services, higher tiers are available at an additional cost. This choose-your-own-adventure style system ensures that those who can and want to pay more can do so, while those who can't aren't left behind. Canada, Australia, and New Zealand, government as a major player. Canada offers an alternative Americans are most familiar with, a single-payer system. Their Medicare system is funded mostly by general taxation. And while the federal government sets national standards for healthcare, each province or territory manages all its own residents. Medicare, yes, they call it that, covers all medically necessary services provided by hospitals, physicians, and dentists, but does not include prescription drugs, eye care, or dentistry for adults. Such services need to be paid for by individuals, although they can purchase private insurance for them as well. Australia presents a more nuanced model. It functions like Canada does as long as one stays within the public delivery system. However, it differs from Canada in that patients can opt for a private system, and they incur more costs if they do so. This dual approach allows people to choose for better access based on their needs and willingness to pay more. The public system, also known as Medicare, I guess no one has a thesaurus, covers most of the costs of hospital and physician services, as well as some preventive and community health services. But about 1/3 of Australians have private health insurance. Such insurance can provide access to private hospitals and specialists, as well as cover services not included in Medicare, such as dental care, optical care, and physiotherapy. New Zealand's system is similar to Australia's, but with its own unique features, such as a stronger focus on community-based care and public health initiatives. Such an approach aims to reduce the burden on hospitals and provide more holistic care. The public system provides universal coverage for a range of services, including hospital care, primary care, prescription drugs, mental health care, and disability support services. Unlike Canada, though, they also have a private system that plays a supplementary role by offering faster access to elective surgery and specialist consultations, as well as covering services not funded by the public system, such as dental care and cosmetic surgery. About 1/3 of New Zealanders have private health insurance. France, public baseline with add-ons. France offers a system where the public sector sets a good baseline for all, but people are encouraged to spend more if they wish. The public system, known as Social Security, I swear I'm not making this up, covers most costs for hospital, physician, and long-term care, as well as prescription drugs. Patients are responsible for co-insurance, co-payments, and balance bills for physician charges that exceed covered fees. However, almost all citizens have supplemental insurance to help with these out-of-pocket costs, as well as dental, hearing, and vision care. The supplemental insurance provided by private insurers, most of them non-profit. This allows for explicit pricing and transparency from doctor visits to private hospitals, giving people the freedom of choice without compromising the quality of the public system. England, socialize everything. In England, the National Health Service, or NHS, provides healthcare to all residents, covering hospital, physician, and mental health care without any cost at the point of care. None. There are no financial barriers to care and no risk of healthcare-related bankruptcies. Yes, there are trade-offs in terms of wait times and sometimes even quality, but it's an option. The complexity of the American system. In contrast, the U.S. healthcare system is a complex patchwork that often seems to combine the worst of all worlds. Employer-based insurance, which sort of resembles Switzerland's system, limits choice by tying coverage to employment. While offering high-quality care, this model often comes with high costs and limited choice. It's a system that works well for those employed in stable jobs with good benefits, but leaves many others in a precarious situation. On the other hand, Medicare is akin to a single-payer system, but comes with its own challenges, including high out-of-pocket costs for specific services and medications. It's a system that offers broad access, but can still result in significant financial burden for those who require extensive medical care. Medicaid offers yet another model, providing a safety net for the most vulnerable population. However, it's a system that varies significantly from state to state in terms of eligibility and the range of services covered. This results in a patchwork of coverage that can be confusing and inadequate. The VA system, which provides care for military veterans, is the closest the U.S. comes to a thoroughly socialized system, similar to England's NHS. It's a system that has faced significant challenges, including long wait times and questions about the quality of care. Still, it also provides a level of financial protection that needs to be improved in other parts of the American healthcare system. This complexity is not just confusing, it's inefficient. It often fails to meet either of our two main goals, access and financial protection. The fragmented nature of the American system creates gaps in coverage, inconsistencies in treatment, and inefficiencies that drive up costs for everyone. We need to choose a better way, but there are multiple choices to choose from. Remember our goals. The first is that people do not avoid care because of costs, and the second is making sure that unexpected illness doesn't lead to financial ruin. We should foster a conversation about the pluses and minuses of each of these possible solutions and pick one. Special thanks to the Commonwealth Fund for helping to support the creation of this episode, as well as the trip, which allowed me to do a lot of the research for it. Hey, you enjoyed this episode, you might enjoy this previous series we've done on international healthcare systems. There's a whole playlist. We'd appreciate it if you'd like the video, subscribe down below. Maybe go to patreon.com/healthcaretriage where you can help support the show, make it bigger and better. We'd like to especially thank our research associates, Joe Sevitz and Edward Lillaholm, and of course, our Surgeon Admiral, Sam.